So I guess one question I'd like to ask you, because healthcare is a lot about politics and who owns what and who's more powerful. And I think part of the reason we needed the information blocking legislation had to do something with that power and taking that data and really, who has the data has the power. But who has it today? Who has that power today? And I guess from everything you've said so far, I would assume you think the consumer or patient ultimately should have the power regarding the use of their data. Who's got it today, and where do you think it'll go in the future in terms of that ownership and power of the data?
Yeah, it's interesting because when I went down this rabbit hole over the last decade, one of the things that I learned is that there's a very distinct difference legally between ownership and consent and use. And ownership, just like if you were to pen a book, right? You are the owner of that IP. You wrote it. So believe it or not, our records when we're in the doctor's office are owned by our physicians legally because they wrote the note. They wrote the diagnosis. They own it. However, what information blocking and interoperability did was they allowed consumers to have the right to access. And the most important part of that legislation is that when a consumer selects to bring their data down through any application of their choosing, they're drawing their data outside of HIPAA. And that was probably the most meaningful part because that allowed for physicians and payers and labs and pharmacies to say, okay, I'm not going to be held, responsible from his perspective.
Yeah, it's not my problem anymore.
You took your data, and if you consent to share that data downstream for any purpose, then that's on you, consumer. You get to make those choices. I actually find this a little bit ironic, and because one of the things we talk about in our company, and it's something that we as a company hold very, very tight against. It's one of our founding principles, which is informed consumer consent. Data is never shared. It is never sold. It is never used for advertising or de-identified. And we don't provide that unless a consumer says, yeah, hey, Kristen, do you and Bailey want to contribute your data for potential clinical trial matching? We'd be like, yep, absolutely. Take all our data. We're donating it to science because we're a unique family. Right?
Right.
But what's interesting is the reason that data has been held on to for so long by all of these technology systems and by providers and others are what we like to call downstream dark data flows. And what that means is that they have the right to de-identify and sell your data all the time. But consumers are never informed that their healthcare data is out there. And when you think about the advanced technologies like AI, it is not as difficult to re-identify data as it used to be.
No, it's very easy.
We are just very, very big believers that consumers, like their credit card history, should have the ability to see a transaction each time their data is swiped. And that allows us to have better transparency and understand more. But the amount, to your point, the big entities out there, the amount of money that is paid for data in our industry is massive. It's completely undoing an entire business.
Right. And, you mentioned the credit card industry sharing that information. So often you'll hear speakers who think they're being really visionary go, oh, health data should be like banking data. And consumers have full control and ability to share that. I see pros and cons to that vision. Tell me your thoughts on that.
Well, one, it's nothing like the credit card industry. If you lose your credit card, you can get a new number and it can be replaced.
That's true.
Your healthcare data is always going to be about you. It is significantly more important to be privatized and to have security and robust security around it. And, there were provisions that were created under HIPAA around things called minimum necessary. And I still think that they're not widely used in our industry. Even transacting data on national networks between providers, right? Traditionally, when people pull information from the networks, they pull all of your history, not just what they need in this current day and time. So if you have 3 decades worth of health history and you're not in a complicating thing, but you just want to find out, did this person have this vaccine so I know whether to administer it or not? You don't need 30 years of history moving in between databases. So, I think we are very much, I think that the concept of transparency is what should be compared from a credit card industry. We can see every transaction that's ever run on our account. We can get alerts set up when something hits our account that doesn't make sense, which today, we have a $3 trillion fraud problem in this country. And do you know, part of that I mean, part of that waste is the fact that we don't get to see every time somebody submits a bill to the insurance company, because most consumers, they're not on a portal looking at every transaction, and they don't understand what they see on there anyway. Because if you go to the hospital, you have separate bills for your physician, separate bills for your anesthesia, separate bills for your facility. So they don't know how to interpret them. But one of the things that I learned working in fraud before launching b.well was, if you perform what we call a desk audit and you go out and you say, I want to look at a randomized 100 charts from this facility or from this DME company, inevitably 20% of those charts would not get returned in order to justify the payment because the visit didn't occur. It was a billing error. And if the consumer get a share of bill, i.e. a copay or coinsurance, they don't actually recognize that their insurance has been invoiced for that. So now when we think about data interoperability, there's as much advantage to businesses as there is to consumers in sharing of that information in real time, bidirectionally at scale, because we can actually start to address some of the problems that are making our healthcare delivery system so expensive.